So we've talked about cardiac pacemaker cells. Now we're going to talk about the variable that they have the greatest effect on, and that's heart rate. And so in this video, we're going to talk about heart rate, and we're going to talk about how we can alter action potentials in a pacemaker cell to alter heart rate. And so we've got these three outcomes that we're going to get through. So when it comes to heart rate and factors or agents or things that affect heart rate, we call them chronotropic agents. Chrono means time. So I've got a watch on. Big fancy name for it is chronograph. Okay, so we're altering time, or we're altering how often the heart contracts. And we do this by altering cardiac pacemaker cell action potentials. Okay, and so that's the purpose of a chronotropic agent. We've got something that's called a positive chronotropic agent. Heart rate will increase. An example of this is norepinephrine, and we'll talk about norepinephrine a lot. A negative chronotropic agent will decrease heart rate. That's acetylcholine. So just a quick refresher, remember that acetylcholine actually increases or activates muscle cells, but acetylcholine actually inhibits cardiac pacemaker cells because it opens different channels. So take a minute, look at this graph. Let me orient you. So on the x-axis, we have actual heart rate in beats per minute, and on the y-axis, we have filling time, okay, time per contraction in seconds. Okay, so for example, if your heart rate is 60 beats per minute, that means that your heart's contracting once every second. Okay, and if we get down to about 40, then we're about 1.5 times or 1.5 seconds per contraction. And if you get all the way up to 200, that means your heart's contracting every 0.3 of a second, which is really quick. Okay, and so heart rate will affect how long your heart has to fill up, and it will affect something called end diastolic volume, which is the amount of blood in your heart prior to contraction. Okay, and so we've got this figure to try and show it. Now, we're going to get into this more as we go throughout this unit, but the big thing that I want you to focus on are these boxes up here. And so we've got what's called diastolic time, or the time your heart is relaxing. This is when your heart fills up, when it's relaxing. Okay, and so in the pink box, there's more filling time, which means your heart is contracting, or your heart rate is lower. Okay, so like 40 beats per minute. The blue box is when your heart's contracting more often. Okay, so think like 100 beats per minute. All right, and so what we're trying to show you here is that the longer you have to fill up your heart, the more blood will be in your heart before it contracts. And so that follows that if you have more blood in your heart before it contracts, it's going to contract more blood. Okay, so slow heartbeat, more blood in your heart, you're going to be able to eject more. Now, you're probably thinking, or you might be thinking about, well, what about exercise? My heart beats really fast, I need more blood. And we're going to talk about how your body is actually able to overcome this reduced filling time, but you're going to have to wait for a few videos before we get there. Okay, so let's go back to the cardiac pacemaker cell action potential. The distinguishing feature of the cardiac pacemaker cell action potential is drift. And what's really nice is that the autonomic nervous system only affects drift. Okay, so let's talk about how this happens. So first of all, we're just going to go to the sympathetic nervous system. Remember, sympathetic nervous system is fight or flight, get you ready to exercise, get you ready to run. This is where your heart rate is going to increase. And it does this through the help of norepinephrine. As we mentioned a moment ago, norepinephrine is a positive chronotropic agent, and so it binds to beta adrenergic receptors that are on your pacemaker cells. And really, we're going to focus on the SA node. Okay? And so what this does is this increases sodium permeability by opening ligand-gated sodium channels. Remember, norepinephrine is a neurotransmitter. It is a chemical. Chemicals don't affect voltage-gated channels, but they affect ligand-gated channels. So basically what's happening when we have a sympathetic response is we're opening two different sets of sodium channels. Okay? You've got the voltage-gated sodium channels that are just open because of where membrane potential's at during drift, and now we're opening a second set of doors that norepinephrine is the key to. So as a result, we have a lot of sodium influx. And so as a result, the slope of the drift increases. In other words, membrane potential becomes less negative more quickly. We reach threshold sooner, heart rate increases. Now you might be trying to visualize this in your mind. There you go. Okay, and so we've got this diagram here. notice that, well, first of all, let's focus on depolarization or repolarization. They look essentially the same. The only thing that's changed here is drift. And so notice drift in the red line, or the one that's on the far left, it's steeper, so we hit threshold more quickly. And so you can have more action potentials in a shorter period of time. Then we've got the parasympathetic effect on cardiac pacemaker cells. In this case, acetylcholine is the neurotransmitter that's released by the parasympathetic nervous system. It binds to muscarinic cholinergic receptors. This should be reviewed from our autonomic videos. And as a result, acetylcholine is a key that opens potassium channels. And so we open ligand-gated potassium channels. So that's letting potassium leave the cell, but at the same time, you still got sodium channels that are open, those voltage-gated sodium channels that are open during drift. And so what happens is that some potassium goes out of the cell, and so this offsets some of the sodium that goes inside the cell. Okay? There is still more sodium entering, because if there was more potassium leaving, we'd never hit threshold, and that would be bad. So as a result, potassium efflux causes membrane potential to become hyperpolarized or more negative. And really what we're saying is that it's slowing down that rate of depolarization. And we can see this because the slope is reduced during the drift phase. As a result, thresholds reached later, our heart rate decreases. I want to be clear, we're not becoming more and more negative. Really what's happening is we're slowing down the rate of that depolarization during drift. And it looks like this. So in this case, we've got the purple line. In the purple line, we've got voltage-gated sodium channels that are open, which is causing that drift, but there's also those ligand-gated potassium channels that were opened by acetylcholine that lets potassium leave, so that reduces the slope. But notice depolarization, repolarization look the same. So if we look at all three of these, you can see the differences, or get an idea of the differences between the sympathetic and the parasympathetic nervous systems and what a normal pacemaker cell action potential looks like. So at the end of this video, can you define chronotropic agent? Can you describe the relationship between filling time and end diastolic volume? And can you describe how each branch of the autonomic nervous system alters heart rate? And I'm not saying, oh, sympathetic increases, parasympathetic decreases. Be more specific. What's the neurotransmitter? What kind of channels does it open? What's the effect?